ThedaCare in color. It's how to choose a primary care provider, connecting you to personalized care to fit your priorities. Here's your host, Cassandra.
Our contestant today is Dr. Patrick Terry, a family medicine doctor at ThedaCare Physicians-Oshkosh. A desire to help people led him to become a physician. Today, Dr. Terry lives in Appleton with his family and enjoys spending time outdoors. Dr. Terry, welcome.
Thank you.
So first, we want to get to know just a little bit more about you and the work that you do. From your perspective, why is having a primary care physician or provider, a PCP is what it's also known as, why is that so important?
Super important to have a family doc. We try to catch things early while they're small before they become large problems.
Do you find that a lot of times people might not have a PCP?
That's pretty common that we don't see that, and it's interesting because women have a family doctor more often than men do. Men typically won't show up to the doctor unless they have a fork sticking out of their eye. So.
And that's not when you want to see them?
No, absolutely not. I'd like to catch them much before that and see if we can prevent problems.
Okay, and again, studies show that having a PCP leads to better health outcomes. It's also a cost savings measure. So how does that all play out too?
Sure, that comes down to the same thing. As if we're catching a problem before it really develops and advances, then we can solve the problem with much simpler means than doing more aggressive treatments.
Absolutely. Okay, now we know why it's important to have a PCP, so we're going to dive into our game here.
How to choose a primary care provider with ThedaCare.
Dr. Terry, we have a few patients who are looking to find a primary care provider. They have some questions about the process, so you're going to listen to their questions and help guide us through some of the answers.
Okay.
How does that sound?
That sounds great.
Okay, let's take a look at our first patient's question.
DO, MD, internal medicine, what are the differences between the credentials and areas of focus?
The differences between DO and MD, both degrees go to medical school. So we all go to medical school and then we go to residency following that. The DOs in general will practice more hands-on. They'll do more diagnosing with their hands, but they also treat just like MDs do. Interestingly enough, is a lot of DOs will practice with manipulative medicine as well, and there's many who don't. So it's important to ask if your provider does that, if that's something you're interested in. In regards to internal medicine can be MD or DO. In general, the internal medicine field was started for inpatient hospital medicine, and over the course of time, those lines have kind of blurred a little bit. Some family docs will work in the hospital, and some do just clinic only, just like internal medicine do. Some are in hospital and some do clinic only. Some do a mixture of both. If you get pretty complex as a patient, a lot of times some family doctors will feel more comfortable you seeing an internal medicine physician. There are some people that an internal medicine physician will not see. Pregnant patients, they typically won't see. And it takes additional training for internal medicine physicians to see pediatrics.
Oh, well, these are all things I did not know. Those are great answers. Okay, our next question.
Can my PCP be a nurse practitioner or a physician assistant?
The answer is yes to that. At ThedaCare, we have all three. We have doctors, physician assistants, and nurse practitioners. There's quite a difference in training between the different fields. Fortunately, at ThedaCare, we seem to have a real good group. They'd be glad to help take care of you as well.
Okay. Our next patient has a question.
What if I'm seeing other people as well, like a specialist?
Well, if you're seeing other people, you should talk to your wife about that. If you're seeing a specialist, so as a family medicine physician, we like to think of ourselves as the quarterback of your care, right? So a lot of times I'll have patients who will come in and they'll say, I would like to see this specialist, right? And my thought is I would like to try to do my best to take care of you. So I always kind of take the patient's goals in mind and see the best way to achieve them. Many times it's not to go straight to a specialist. Many times it's something that we can take care of ourselves, and we really try to do the best to do that. In general, specialists are even harder to get into, and it's usually more costly, and they typically don't spend as much time as a family physician will with you. So if we can get a couple of chances to try to fix the problem before we refer you, that's always a beneficial thing to you. It's also a cost-saving measure to you.
And it helps with that continuity of care, right?
Correct.
Okay. Next question.
Sometimes I might need after hours or when my PCP isn't available. What are my options?
One, it would be nice to choose a PCP that has availability to see you, right? So we do have quite a few providers at ThedaCare who have large patient panels, and they're tough to get into. So you really need to think a couple of times to decide, do you want to establish care with somebody that you're only going to be able to get into, with a 3-month or a 6-month wait? That'd be an important question if you're planning on seeing a physician more often. If you've made your decision, you have your family doc, and you need to get in and get seen. If they're not available, there's lots of physicians that are newer to ThedaCare who have lots of slots who'd happy to see you. There are a couple of other resources, video visits and e-visits, that are available as well.
Okay. All right, let's hear from our next patient.
What if the relationship with my PCP isn't what I'm looking for and I found a better fit with someone else? Does this need to be an awkward situation?
Absolutely not. So the providers at ThedaCare are fantastic. We all want what's best for the patient. So the general goal is to help you reach your goals. So if there's a provider that's going to do a little bit better job, that you mesh with better, that has more availability, that has more or less hair, we really don't care what it is. We just want you to be taken care of.
Okay. Our next question.
How do I go about finding a PCP? Where do I start?
So ThedaCare has some resources there, and you can see who's available. You can check their availability, see how far out they are. Those kind of questions would be important. You can also see a lot of biographies. We have videos online that you can see about them.
And that's great, right? The directory shows a lot of different things. It shows your background, it shows languages that are spoken. It's a really great resource for patients.
I'm glad you brought up the language spoken, right? So that can be a huge part of patient care, right? So we want to make sure, if it's possible, if you can get someone who speaks the same language as you as a primary language, that'll make a huge difference in your care as well.
All right, Dr. Terry, this has been a really great information. We appreciate you being with us.
Thank you.